Welcome back, Dr. Lindy here, and we are going to be looking at some hormones that are involved with inflammation. So these are some miscellaneous hormones that are called eicosanoids, and these are some local hormones that are released by all body cells. And the two biggies are going to be called leukotrienes and prostaglandins. Now, leukotrienes are going to influence white blood cells, and they're involved with inflammation. Prostaglandins also involved with inflammation, but they're involved in smooth muscle contraction. Think of a woman's uterus during that time of month. When the myometrium is contracting, the woman experiences cramps. So the woman may take aspirin, and aspirin is a prostaglandin blocker. So the smooth muscle contraction never takes place and the cramps go away. Prostaglandins also are involved in increasing body temperature. So if you have a fever and you take aspirin or you take ibuprofen, what happens to the temperature of your body? If there's a bacterial infection or viral infection, it then goes down. Prostaglandins are also involved in mucus production within the stomach or the gut. So if someone takes aspirin, it blocks the mucus production of the stomach because it blocks the prostaglandins. And if there's no mucus protecting the stomach, and the stomach has all the acids in it, that hydrochloric acid, a person can get an ulcer. So we're going to look at these prostaglandins on the left and the leukotrienes on the right. Now, the precursor to them is called arachidonic acid. Now, arachidonic acid is metabolized to produce these inflammatory mediators. Arachidonic acid is found within the cell membrane. The more arachidonic acid you have, the more precursor you have to prostaglandins and leukotrienes, which means the more precursor you have to inflammation. So you can either be careful with the amount of arachidonic acid in your diet, right? Arachidonic acid is high in shellfish, it's high in peanuts, it's high in most animal products, especially if it's traditional and not grass-fed animals. If they're grain-fed, they're going to be very, very high in arachidonic acid. So prostaglandins create pain, inflammation, and swelling. You see that here on the left-hand side. So people could take these prostaglandin blockers like aspirin, ibuprofen, or these COX-2 inhibitors. So there are these COX enzymes. They're called cyclogenase 1 and cyclogenase 2. Aspirin and ibuprofen blocks this COX-1 pathway, and then like Celebrex is a COX-2 inhibitor. So they affect these different pathways. Leukotrienes are involved with airway constriction. So if someone's having a bad asthma attack, they could take a leukotriene blocker so that it blocks the inflammation involved around the airways, right? Bronchoconstriction, the airway obstruction. So leukotrienes are involved with most of your airways, the inflammation around them, and prostaglandins are involved with the inflammation in the other tissues. Okay, all right. And to finish up, we'll talk about some of these endocrine disorders.